classroom for our topic today is about abnormality in behavior or abnormal social personality. So people ask, what is an abnormal personality? It follows that a normal personality is one whose conduct conforms to an authoritative standard, and an abnormal personality is one whose conduct does not do so. So what is abnormal psychology? Types of disorder: anxiety disorders, mood disorders, personality disorders, schizophrenia, delusional disorder, substance use disorders, somatoform disorders, and dissociative disorders. What is abnormal? Deviating from normal or average. The study of behavior patterns that diverge widely from generally accepted norms. Ways to define abnormal psychology. There are two ways to define abnormal psychology. These are statistical deviation and maladaptiveness. Statistical deviation. Most human characteristics are nicely distributed along a smooth bell-shaped curve. Those who stray too far from the average on this curve are then considered abnormal. Maladaptiveness. Maladaptive to oneself, inability to reach goals, to adapt the demands of life. Maladaptive to society, interferes, disrupts social group functioning. Types of disorders. Anxiety. What is anxiety? People with anxiety disorders feel an abnormal amount from common things. In all types of anxiety disorders, anxiety is the main symptom. Types of anxiety. 4 major types of anxiety disorders: generalized anxiety or panic, phobias, obsessive compulsive disorders, post-traumatic stress disorders. What are phobias? Phobias are fear of a specific stimulus or situation. The sufferer of the phobia usually knows that the fear is irrational but cannot do anything about it. Types of phobia. Phobia has 3 subclasses: simple phobia, social phobia, and agoraphobia. Obsessive compulsive disorders. An obsession is the persistent intrusion of unwelcome thoughts, images, or impulsive that cause anxiety. Okay, let's go back to obsessive compulsive disorders. It is an obsession, a compulsion. Individuals with obsessive compulsive disorder know that their behavior is irrational but are unable to resist. Resistance only causes them to become anxious, and only the carrying out of the act will really relieve the anxiety. Post-traumatic stress disorders. These are caused by traumatic event that overwhelms a person, ruins their ability to cope with situation, can cause flashback, nightmares, insomnia, and guilt. Extremely long-lasting. Mood disorders. These are disturbances of normal mood, also known as affective disorders. Types of mood disorder. 2 general classification for mood disorders are bipolar disorders or manic depression, swings from depression, extreme sadness, to mania, extreme happiness. Depressive disorders, extended unexplainable periods of sadness. Personality disorders. A person with personality disorders uses improper and immature ways to deal with problems or situations. Does not feel like they are doing anything wrong. Thus do not want to change their behavior. Schizophrenia. Schizophrenia is a mental disorder characterized by disintegration of thought, processes, and emotional responsiveness. The psychiatrist Kurt Snyder listed the forms of psychotic symptoms that he thought distinguished schizophrenia from other psychotic disorders. Schizophrenia patient may be experience hallucination, delusion, often bizarre or persecutory in nature. This is divided into two subcategories: persecutory delusions, delusions of reference, positive and negative symptoms. Causes of schizophrenia: genetic or environmental factors play a role in schizophrenia. Genetic, there are more chances of disease was present in ancestors. Environment, drug use, living in urban environment. Social isolation and immigration related to social adversity, racial discrimination, family dysfunction, unemployment, and poor housing conditions. Delusional disorder. These are uncommon psychiatric conditions in which patients present with circumscribed symptoms of non-bizarre delusions, believes that he is the greatest, strongest, fastest, most intelligent person ever. Symptoms: patient expresses an idea or belief with unusual persistence. The individual tends to be humorless and oversensitive, especially about the belief. Substance use disorder includes substance abuse and substance dependence. It refers to the overindulgence in and independence and dependence of a drug or other chemical. The disorder is characterized by a pattern of continued pathological use of a medication, non-medically indicated drug or toxin. Causes: adverse social consequences related to drug use such as failure to meet work, family, school obligation, interpersonal conflicts, or legal problems. Dissociative disorders, also called group disorders, characterized by a disruption in normal functioning of consciousness, identity, memory of the world around me. Can be acute or chronic. Causes: borderline personality disorder, alcohol abuse, sexual abuse, types of personality in drugs, dissociative fugue, dissociative amnesia, depersonalization disorders. Impulse control disorder, high firm emotion types, pathological gambling, sexual complexity, kleptomania, trichotillomania, intermittent explosion disorder. Causes: disturbances in neurotransmission, bad childhood experiences, and frustration. How do psychologists view suicide? In the psychological sciences, most suicidologists admit degrees of suicide are based on individuals' beliefs, strength, and intention and attitudes. How people have explained abnormal behavior. The legal definition of abnormality declares a person insane when a person is not able to judge between right and wrong. Class, so here are some questions you must answer and write down your answers in a white bond paper, short in size, and send the soft copy to our Google Classroom email and keep the hard copy for future use. Okay, so people ask these common questions about abnormality in psychology. Number one question: what are the 3 Ds of abnormal psychology? Number 2, what are some questions that psychology tries to answer? What topics are covered in abnormal psychology? What are some psychology questions? What are the 4Ds of abnormal psychology? What is abnormal behavior in psychology? Is abnormal psychology class hard? What are the elements of abnormality? What are the types of abnormal psychology? Well, guys, for the question of this, you can search it right in Google. Example, here you can click in Google this arrowhead here, and it will give the answer. Okay, example, what are the topics covered in abnormal psychology? Just click here and it will give the answer. Okay, so just click this arrow here at the right side of the page. Okay, just like that.